my name is Glenn Messman. I'm the Assistant Training Director of our Clinical Psychology Doctoral Program at the University of Arkansas for Medical Sciences. We are an APA accredited program, and we offer training through a child track, an adult track, and also an adult neuropsych track. For the child track interns, they receive considerable experience in evidence-based psychological assessment and a variety of treatment, intervention, and models for kids who've experienced traumatic stress. And these experiences occur both in an inpatient and outpatient clinic settings. So today we're going to do a tour of the Child Study Center, which is considered the clinical and administrative home for our child track interns. The Child Study Center is an outpatient psychiatric clinic for kids birth through age 17, and it's located on the campus of Arkansas Children's Hospital, and it's just a short distance away from the main campus of UAMS. Our clinic is multidisciplinary in nature, so child track interns get to spend considerable time collaborating with and coordinating with the other experts and specialties in the clinic, including counseling, psychiatry, and social work. And we just find that the collaboration and coordination across disciplines is really helpful for improving patient outcomes, and also really just enhances the overall feeling of cohesiveness across disciplines within our clinic as well. For our psychiatry training program, there's psychiatry faculty, residents, and child and adolescent psychiatry fellows that conduct psychiatric diagnostic assessments and also medication management. And our counselors and social workers offer evidence-based psychotherapies for children, adolescents, and their families. Another important rotation for child track interns at the Child Study Center is the psych testing rotation. So here we have our psych testing closet that contains a lot of different psychological tests and measures and forms. It also hosts a variety of different testing kits, and also it's where we store our completed evaluations in locked file cabinets. We have a lot of different measures for intelligence and academic achievement, adaptive behavior, personality, and social emotional functioning forms as well. And a lot of our evaluations are for a variety of different reasons. They can be for diagnostic clarification, assessing the child's level of functioning, and also helping with treatment planning. So our interns are able to see young children, school-age children, adolescents with a variety of emotional and behavioral concerns. And there's also an opportunity for them to do comprehensive trauma-informed evaluations through our UAMS Complex Trauma Assessment Program, which we have specialty referrals for kids in the Arkansas DCFS system that really need help with diagnosing and clarifying the different mental health concerns that they have, and also making sure that they are being referred to evidence-based treatment practices as well. So parent-child interaction therapy, or PCIT for short, is one of our training opportunities that we have here at the Child Study Center for our child track interns. So PCIT is an evidence-based dyadic intervention for young kids with behavior problems and their caregivers. And we just really like PCIT because we know it is really helpful for improving that parent-child relationship and also reducing some of those behavioral difficulties as well. So we offer a variety of different training opportunities for the interns depending on their level of experience and familiarity with the model. So if interns don't have training with that, we'll be pairing them with a trainer and someone who can help them through learning the model. And if they already have some experience and meet national certification guidelines for being a therapist, we can train them in being a level 1 or with an agency trainer as well. So we do have 2 fully equipped PCIT rooms. As you can see, we have cabinets that have all these PCIT approved toys for kids in their early childhood. There's an observation room that we'll talk about a little bit more and show you. And also there's our backup space as well. So for kids, if they get off the timeout chair, there's a place for them to go as well. So I'll show you the observation room a little bit. So we'll walk out into the hallway and show you what it looks like from the inside. So an observation room is just over this way. And in our observation room, you can easily see the parent-child dyad as they connect with one another and communicate with each other. And we coach them through a Bluetooth device so that the parent can hear us talk. And then we can easily see into the timeout backup space as well.
Hi, I'm Dr. Safna John. I'm another one of our faculty supervisors here at UAMS on the child track, and I figured we could show you a little bit around the rest of our facilities. So come on and follow me. This is actually one of our intern spaces. Each of our interns on the child track gets their own offices in which to do some of their clinical work. And so in addition to PCIT, which Dr. Messman just mentioned to you, we also offer really comprehensive training in 2 other evidence-based treatment models. The first is child-parent psychotherapy, or CPP for short. That's an evidence-based, relationship framework-oriented therapy that focuses on children birth through 5 who have experienced traumatic events and can kind of help with a whole host of difficulties, ranging from emotional, behavioral, social, and relationship-related issues. We also offer training in trauma-focused cognitive behavioral therapy, or TFCBT, which is an evidence-based treatment program for children ages 3 through 17 that focuses on treating post-traumatic stress symptoms with children alongside a supportive caregiver in treatment. So we really like to customize the training experience that interns get. And so what we like them to do is pick 2 of those therapies to be a major rotation and 1 to be a minor. What you choose as your major rotations will take a bulk of your clinical time here and will really help you to make substantial progress towards certification. What you choose as your minor rotation means that you'll still get some exposure to the model, but with fewer cases, so you're really allowed to focus and specialize on the evidence-based treatments that matter the most to you. We are all having to make adjustments in our clinical practice and other activities in light of COVID-19. I think one of the unique things that you get here at UAMS is you get to learn all of these evidence-based treatment models from a certified trainer. That way you can be sure you're practicing with fidelity, even in these changing times, and that your clients can hopefully get the best outcome possible. So in addition to providing evidence-based treatment and assessment services at the UAMS Child Studies Center, our interns on the Child Track round out their training experiences through a few different rotations over on the main campus at UAMS. The first is our Child Track interns are able to provide individual therapy services with adults at the Walker Family Clinic using models like cognitive processing therapy, or CPT. Our interns also rotate on our really innovative child diagnostic unit. The CDU is a 28-day inpatient stay in which children with really complex presentations and at-risk behaviors go to get diagnostic clarification and thorough assessment from a variety of disciplines, including nursing, psychiatry, speech, psychology, obviously, social work. And what we really enjoy about the child diagnostic unit is, 1, children are able to go through an entire medication wash, thereby really helping us to determine what psychotropic medication might you need, really, if any, as well as each child gets their own room, which means that their caregiver is able to stay on the unit with them for the entire duration of their stay. Finally, many of our interns elect to do a research rotation in which you're paired up with a faculty mentor to really help you achieve your unique scholarly goals. If you're not coming in with data, don't worry about it. We actually have plenty here to choose from that'll help you answer some important questions on childhood traumatic stress, parent and child relationships, evidence-based dissemination and implementation, and really help you focus in perhaps on some unique, vulnerable specialty populations because our data sets are so large. So finally, one thing we hope to convey in all of these videos is our faculty's shared commitment to serving those who are underserved. The UAMS Child Study Center is in the same outpatient building as several other programs that really focus on providing the best we have to families who have experienced trauma, whether it be through our Child Advocacy Center right downstairs or through our medical evaluation unit with specialty abuse pediatricians up on the same floor that we are. We hope that we gave you just a glimpse into what life might be like if you choose to do your internship here at UAMS. But what's kind of difficult to convey over video is really some of the strengths that I think our program have that are really unique. The first is that our faculty is extremely cohesive and extremely training centered. The second is that we have a shared value and commitment to providing the best we have to our families when they are going through, I think, some of the most challenging events that they will have to experience in their lifetimes. And so please feel free to reach out if you have any other questions, and we hope to virtually meet you sometime soon. Thanks.